Okay. So a little bit about myself. I'm a neurosurgeon at Apollo Hospital, and this slide gives my 4 affiliations. India International Center, of course, I'm really obliged that you've given me an opportunity to highlight this problem with the elderly. And Kara Foundation, which I formed few years ago in the memory of my father, just to promote assistive technology. Indian Head Injury Foundation, of which I'm a medical director for 15 years, just trying to promote neuro rehab. We have 3 centers. Oh. Yeah, that's what it is. So we have 3 centers in Delhi, Jodhpur, and Patna, and in Noida. It's about to start. And this is for the common man, and it's free for people below the poverty line. So those are my affiliations. And so I'll move on. Oh, sorry. So today's topic is falls, a leading cause of disability in the elderly. I thought if I didn't mention falls, I would not get a big audience like this. So I thought, let's use a catchword, and that's falls. And as my friend Rajgopal said, that is the leading cause of problem in the elderly. So what I'm going to cover in the next 20 minutes is what are the causes of neuro disabilities, why people fall, and what kind of injuries they sustain, what can we do to prevent the injuries, and what are the solutions? So now, so I'm using WHO slide, Mr. Amil and Dr. Patanjali. These are WHO slides. I'm some form of panel with your WHO, so I can use that. So the number, more than 1 billion people in the world have disabilities, and that number is increasing because at independence, maybe our lifespan was 50 to 60 years. Now it's 80 or thereabouts. And the number is increasing. Non-communicable diseases is like stroke. That Mr. Srivastava, you asked me the other day, why are people in the villages at 40? Why are they getting strokes? I think it's a matter of research. And Mr. Ravinder from ICMR, sir, we need to take this further research into non-communicable diseases. And so if I ask for grant for research, kindly let it come through. And we are short of funds. And road traffic accidents, one every year, in that number are government figures. We all know that is recorded, but 5 times as many. This never comes out, and I have a problem with newspapers. They never mention that if 0.5 lakhs are dying, there are 5 lakhs who are being disabled, and add that to that number, and there are 1 million people every year with strokes, head injuries, and that need help. But they never talk about that. They say death. Death to ho hi gaya. So now there are different age groups. And so in young, you'll have spina bifida, cerebral palsy, autism. In the young, 20 to 40, the major cause of disability is head injuries on the road. So the government is trying to halve the number of deaths by 2030, but it's not going to succeed. So we are going to stick to the elderly. What causes disability in the elderly? Falls, stroke, mental health disease, head injuries from road accidents, and in the seniors, most of us sitting at the back seat don't wear belts, and kindly get used to it. I've got used to it. Parkinsonism, arthritis, spondylitis. So I'll just cover a few of these. So those were the figures for the world. In India, 137 million people are above 60 years of age. And WHO has included these people who need help with some form of assistive devices. Half of us have this assistive device, our glasses. Many will need many more than that. Falls and fractures. I'm sorry to say, females, you're twice as likely to get a fall and a fracture than a slot. One warning sign is recurrent falls. So yesterday I saw a patient, day before yesterday in the clinic, he said he's got this because ye dekho 3 baar gir chuke. I said, what did you do the first 2 times? We thought, agle baar nahi hoga. And they didn't address. We all do. It's not them. We all. All my patients, Ashok, you will tell us later. It's not the first fall that brings somebody to attention. It's the second, third, fourth. If we were addressing this before it happened, it would get solved. Now, some of my friends would say, okay, then let's stay in bed. Let's keep Papaji in bed. Well, Papaji, if he stays in bed, he will fall more frequently because lack of exercise. If you had a viral fever and you lay in bed for a week, you'll wake up weaker. So if you're in bed for a longer period of time, your muscles and your stability would go. Dr. Rajgopal mentioned osteoporosis. I'll cover that. One thing, 2/3 of the fall, Indian statistics, happen at home. So if you don't worry what about Papaji will fall outside, just cover what's going to happen at home. And so what if you're fallen? What is the problem if you're fallen? Well, there is a problem with physical health, of course. They break a bone. There are economic consequences because many of our parents would live with us. And so therefore the caregiver's problem, insurance doesn't cover rehabilitation and assistive devices. So, and the person is not productive. So there's a psychological impact of being senior or being isolated. Because how many of you have visited a friend at home in the last 2 weeks, 3 weeks? You haven't. I haven't. So if you're isolated at home, there's going to be trauma, psychological. So Dr. Rajgopal has mentioned about fractures. That points to that even a layperson can see the fracture. That spine is fractured into two. That hip is broken, and somebody like Dr. Rajgopal has fixed it. And so the person has been able to get out of bed. You're all familiar with the bone density scan. You don't need to look at figures. Look where that cross is. It's on the red. So you take out your bone density scan when you go home. If you hadn't had it done, get it done. And if that cross is below the red line or even in the yellow line, you need attention. So osteoporosis, more in the elderly, 36%, women and elderly. Dr. Rajgopal mentioned vitamin D deficiency, early menopause. There's a genetic predisposition of Indians to get osteoporosis. And there's a lack of diagnostic facilities. Even those of us who have the facility don't get it. So you need to get your bone density done, and you need to be aware that you're genetically predisposed. And yeah, that's a blood clot in the brain. What happens? That's how we scoop it out. I'm sorry if it's repulsive to some people, but I think it looks nice. There's that blood clot being taken away from the brain. And that's a spine fracture. This is something I do. A lot of us, including me, are on blood thinners. I'm really, really careful of preventing falls. So if you have a fall and you're on blood thinner or anticoagulant, a minor injury will become a major injury. So most seniors, even now, prophylactically, up 60 ho gaye, you're hypertensive, go on aspirin. That's no longer true. That should not be done. You have to have a brain reason or a heart reason. You may be in for a stroke or a heart attack. Only then should you be on aspirin. Otherwise, you will fall and have a major injury. So what's the problem? I'll lie in bed. Well, if you lie in bed, and orthopedics know, even his mother, Dr. Rajgopal's mother at 96, why did he operate? Because he wants to get her back on her as quickly as possible. Lying in bed will cause deep vein thrombosis, clot in the leg, goes to the lung. You have pneumonia, bed sore. It's a vicious circle. The longer you lie in bed, the muscles will get weaker. And you depend on caregivers, which is difficult nowadays, and social isolation. So what are the 5 preventive things I want to highlight? Make your home safe. What can a layperson do? Make your home safe. Get your eyes checked. Get your health checked. Get your medication reviewed. Stay active. And use neuro rehab and assistive technology. So I'll cover very briefly, 1 minute each on each of these points. So, it's very nice to have all the nice things around you, but if it causes a clutter on the way to the bathroom, on the way to the stairs, you may fall. So that house is cluttered. It needs to be decluttered. And this bed is not only for hospitals. Okay, I've used it for family members at home because when I go to sleep, I worry, will they fall? And this is available on rent. You can buy it for 1.5 lakhs, 2 lakhs, but bed with railing is an essential part of an elder's looking after, because you wouldn't want your dear ones to be tied and restrained while you sleep. One time you will sleep, something will happen. So bed railings are a must. Now, the important part. Even in our house, we found we had railings on one side, and my mother would say, "Dono side rehta to acha rehta," because I'm very scared I may fall. Even 4 steps, my mother, she pointed out every time that I don't think it's safe. Then commodes, all our WCs, for some reason, are meant for people with strong legs that you can get up. You need a good hip flexion to get up from the chair. If your commode is low, you'll stumble and fall. And therefore, you need attachments to go on the commode so that you're almost in a about to get up position. And there have to be railings on the side. In the bath area, there has to be railings, there have to be mats outside, and you need to be sitting. And if you can't do all that, then get a commode chair. So one of my family members is at home with me. I can't take her to the bathroom for the shower because the bathroom doors aren't meant for wheelchair. So we can have your house checked, and we can her own team here, Kara and Indian Head Injury Foundation. You can send us pictures. If wheelchair can't enter your bathroom, can you imagine an elderly person would have a big struggle, believe me. And then there is this watch which my son just said, oh, you're talking about all this and you're not talking about this new Google Watch. I said, acha, jaldi bhejo. So 5 minutes ago, we put this on. This Google Watch and others, they alarm you. So if you put this on to your senior and for 30 seconds they don't move, it will send you an alarm. He will send the alarm, or the watch itself will dial an emergency number. I think it's fantastic because at 2 in the morning, when you have fallen in the bathroom, there ought to be a phone in the bathroom, but if you're on the floor, you won't get to that phone. But if you have a wristwatch and you're sitting like all American, a lot of our NRI children, they're sitting in New York, they can say, Papa ji has fallen down, let's do something within 30 seconds. So, and the carpet. How often have we nearly slipped on carpet's edges? So we need to be sure that loose carpets are not near elderly people where they are going to walk. Next, number 2. There are only 5 points, so bear with me. Number 2, 1/3 of people, and Dr. Rao here will talk about elderly and the vision, 1/3 have problems. And these are common problems: cataract, glaucoma, age-related macular degeneration. And more importantly, you lose your peripheral vision, and Dr. Patanjali is an eye surgeon, and you lose your adjustment to light. So if you're 70, you get out of bed and rush to the bathroom, Arey, humne light jala diya. But your adjustment to light will take time. Your adjustment to distance will take time. You don't know where your foot is going. So with vision, and then there's diabetes, which 1/3 of the country has or will have, and then 1/3 of people will have diabetic changes in the eye. So eyes are a major problem, and therefore I've called from IIT Professor Rao, whose major work is in vision. So number 3, health checkup. Why is health checkup important? Because all these will cause weakness, cardiac problems, hypothyroid. Your thyroid level has to be proper, osteoporosis, diabetes, hypertension. So when I see a person in my clinic and I can't see them getting up from a chair, I said, Aapko proximal muscle weakness hai? Have you got your thyroid checked? What is your HbA1c? Because those, forget your MRI. I just said MRI mein dikh jayega. I said MRI mein nahi dikhega ki aapki leg weak hai because of thyroid or diabetes or stuff like that. The other thing which in my research, I had to do a bit of research to come here. And I found that anybody who's on more than 4 drugs, so statistically it's been proven that if you're on more than 4 drugs, you're an elderly, there's a higher chance of you falling. So your drug combination needs to be checked. And everybody goes to this doctor and says, pain ho raha, bola gabapentin de do, triptomar de do, ye sab de do. But they don't realize that when you're senior and a male, you're already getting up 3 times to go to the bathroom. So if you're getting up 3 times and you're on painkillers, and Ultracet, everybody knows Ultracet. You've heard of Ultracet? Well, that has tramadol. That's an opioid. So you're on an opioid. You can't see properly because it's dark. Your muscles are weak. This is a recipe for disaster. And so get your medicine checked and say, listen, if I want to take my painkillers or whatever, I'll take it at 5 in the evening or 6 in the evening, not at 10 in the night. And then there's something called postural hypotension. You want to jump out of bed. Postural hypotension is ki chakkar aa gaya, suddenly you're standing. There's nothing wrong with you, except that you need to maybe get your medicine checked and you take your time getting out of bed. And most of all, I go to my pharmacy in my colony. So often the guy comes up, "Arey yaar, lag raha hai blood pressure badha hai, kuch dawa de do." And the guy just gives it. And then I have a major fight with him. Hey, what the hell? And so painkillers are dispensed, blood pressure medicine. Why? Why should I give $200 to a doctor? Or in Dr. Rajgopal's case, a bit more. to get his consultation. अरे pharmacy को बोलो 200 रुपए में तो दवा भी आ जाएगा. So avoid self-medication. And as I said, sedentary had more falls. So in my research, I found that in US, if like Tarun Lala here, head of neuro rehab at Max, they do RWA, they bring screening to the RWA and find who are susceptible. So in US, Tai Chi and yoga, that is given as a sole intervention, right? So if you're not osteoporotic, if you're not hypothyroid, if your vision is fine, all that, but you may still fall. So Tai Chi is really good. And I will take to that. Ashok, you'll join me as well. Yeah, you live nearby. So I'll join you and you take lessons. And so it's something to do as a group. So it does a community, it does a group activity as well as help prevent falls. And one thing, so why is neuro rehab important? And a lot of seniors, they want to get back to their life. They want to drive. Now, I just got a few months ago, Hemant, you know this gentleman in England, an Indian guy who fell out of a taxi in London trying to just get out of a car. So it's not only driving. Is this person safe to get into the driver's seat and safe to get out? Because a lot of falls happen in and out of chairs. So getting back to your normal, and that lady there, she's a fellow Rotarian. It's important to her to join her club and to go there and play cards. So social integration for quality of life is what is important. So rehab starts in the hospital. I have permission from all these people, by the way, to show them. So it can happen in the hospital, and then you move to a home rehab, and then you do a community rehab. Head Injury Foundation, we've done about 1,000 sessions during COVID, tele rehab at home during COVID. So the last few slides is about assistive devices. So you can have walking problem for mobility, you may have vision problem, and you may have activities of daily living. So various kind of walkers. Most seniors, they'll do everything you say, but they won't take a walker. They won't take a stick. And so there are various kind of walkers, and you need to insist on your family member to have walkers. Now, the middle walker, you need strong hands. If you don't have strong hands, you need what's called a gutter walker. Can you run that? So this man's hands are weak and the legs are weak. So he can't walk with an ordinary walker. He can't use a stick. He needs to rest his arm on a gutter walker. So who will tell you what you need is a neuro rehab professional. That you need this walker or that walker. Next, please. And through our Head Injury Foundation and CARA, we've distributed a lot of wheelchairs. And thanks to WHO, we've started this program in Patna. But then we realized that by setting up a rehab center for distributing WHO wheelchair, that wasn't okay because people were coming from Ara, Darbhanga, Samastipur. So imagine if you're poor, you're disabled, I'm making them come 50 times. So we've started a project of doing tele-assessment. So we now, most people have smartphones, we assess them at home, and then we give them a customized wheelchair. That is an IIT Chennai invention, where on an ordinary wheelchair, they put a motorized attachment. So these people can go out on a motorbike, wheelchair gets attached, and they go out and they can do whatever. So according to WHO, we do these 6 measurements. I didn't know myself till a few years ago that I thought I just go to Lajpat, I would tell my patient, Yusuf Sarai jao, wheelchair le lo. And then I realized it's like go and buy a size 9 shoe for everybody. The wheelchair needs to fit you. So many seniors say wheelchair mila, but acha nahi laga. Kyun nahi laga? Because these 6 measurements were not taken and did not fit that person. Now there's some activities of daily living, and I just want to point out, and I've got it specially for this. If your hands are weak, and you'll be scared to give the senior a cup with only one. So these simple things like a cup, I got this from the market nearby with 2 attachments, and then he can do. It doesn't help to keep feeding somebody and giving him a drink. If you have a cup with attachments, maybe, and something cold, you can start by that. So this is simple, a cup with that. Then attachment for spoon, for brush. So this can be a longer handle. His hand isn't coming to his teeth. You give this. I got this from the AC repair shop, a rubber pipe. Put this in. You can do that. For buttons, this if you can't. So the first thing with somebody with a cervical problem and hand weakness senior, he said, button nahi lag raha hai or roti nahi tod pa rahe. Well, the button can be sorted out by something like this. He can pull and put the button. Similarly with the spoon, you can have a larger attachment and from here itself, they can be fed. So devices need not be expensive or this belly attachment. So a plate, if he's got something on the side to hold, then he doesn't need somebody to hold his plate. He can put his finger around this and hold. So what I want to say is assistive devices don't have to be robots. It can be very simple things. Sorry. And then, yeah, so next. So, and then for glasses, a few words will Dr. Rao, but simple thing like getting your eyes checked can solve a lot of eye problems. That smart cane, steam, and words about that next. And then there's a lot of things on the where voice, text to voice, and you need to alerting devices. That's all on your phone, but you need to know about it. Next, please. Because I often turn and ask, "Acha, aaj Monday hai ki Tuesday hai? Dawa khaya ki nahi khaya?" And then that box helps. So if you don't have it, you must have this pill dispenser that will tell you it's Monday and you haven't had your tablets, or Tuesday. Video calls, all these, those are card attachments for people who can't use their hands properly, want to pay cards. You need to be doing crosswords. You need your mental exercise. Next. And this, I want to show you the small video that even at our rehab center, we make exercise fun, right? So if you tell a person, haath ka exercise karo, ye dumbbell hai, karte raho, they're not going to do it. So now just see the video of this man. You can see, no, just do that lady. So this man has hand weakness. Now look at that video, if you can enlarge it. She's been told her leg is weak. You exercise your leg and you're supposed to move that basket while that fruit is falling. It's not very clear here, it's not large, but basically, so she's getting mental rehab, cognitive rehab, as well as her paralyzed leg, she's moving. So there's a lot of stuff that's available at centers, as well as gait trainer, balance trainer. This is at our Head Injury Foundation Center. You can improve your balance if you go to Lajpat, to our center, or to the new center there. So why is it not available? Because there's no awareness, even among healthcare professionals. You ask a physio, kahan jaye? He'll say, I don't know, kahan jao. Kahan milega? I don't know, kahan jao. And then there is the importance, if you tell the senior, there's no use. You have to teach the caregiver. How do you look after? Because in spite of a caregiver, my family member fell and repeatedly fell. Ki sir, wo to ab kya kare? Maji hil gayi, gir gayi, ye kari. So the caregiver needs to be taught how to get this person out of bed, how to feed that, and how to bathe. That will be my next program, will be on caregivers. It's the focus on caregivers. And a major area of inclusion is the internet. We have used it widely to monitor senior people and to give tele-rehab. But one very interesting thing, that over COVID, we had so many people who need rehab and so few people to give rehab, like therapists. So some lower limb cutting, and she got 15 of these ladies together, and then they were exercising together. So, okay, next. So they're trying to tell me to stop. I will really. And so what do you need to do in your colony? You need to have screening. You need to have screening, and you need all that, and you need to train people under one roof. And if you help me, we can have such a center for assistive technology in Delhi. We have it in Patna, Mr. Hamil, you visited that. That's just the start. It's just a small thing. With your help of WHO, we started. We need something in Delhi where all technology is under one roof. So the reason for doing it here in IIC is that people should take notice and give us help. Next. And so we need a center where the doctor, the scientist, the IIT guys, the family member, everybody is working to have a specific solution for one person. And that we have. We have the Head Injury Foundation, Kara, all of this, all the people here. Next. They are here today as panelists because they are personally committed. So in conclusion, elderly contribute to a significant number of people with disabilities. Fall result in a significant number of disabilities. There are neuro rehab and AT solutions. We must screen people. Next. And fall prevention is multifaceted. It's not just go and get your eyes checked, go and get your medicine. Everything has to be done together if you want somebody to not fall. And caregiver's role is important. Sir, Dr. Ravinder from ICMR, I think you need to bring attention to the government that an integrated elderly program for the elderly, where prevention, cure, and rehab has to be together. It's in all over the world. And there, in our hospital, Apollo, we have 400 doctors. There's only one geriatric doctor. I asked Dr. Sharma, "Aap aayenge?" He said, "Mera textbook पढ़ लो, मैंने एक पूरा chapter लिखा है, fall in the elderly." So I said, "Sir, हम पढ़ के फिर अगले बार आपको बुलाएंगे." And so there are chapters and chapters written. So I want to thank you all, and I want to thank the people who are online